channel Magic of Medicine. Today we will study about an entity called Rhombencephalosynapsis. Rhombencephalosynapsis is a rare malformation of posterior cranial fossa characterized by fusion of the cerebellar hemispheres. This fusion is because of underdevelopment of cerebellar vermis. So how do you remember this? The definition lies in its nomenclature itself. Rhombencephalon means hindbrain and synapsis means fusion. So rhombencephalosynapsis is the fusion of hindbrain. Now coming to the next slide. The definition of rhombencephalosynapsis. It is a congenital anomaly characterized by absence of cerebellar vermis, which in turn leads to fusion of both the cerebellar hemispheres. So look at this. I have drawn a line diagram here. This is the posterior fossa and this is cerebellum. Look in the midline of cerebellum. There is no vermis here. There should be a structure called vermis in the midline of cerebellum, which is the midpoint of the cerebellar hemispheres, where both the cerebellar hemispheres attach. But here the vermis is absent, and which in turn will lead to fusion of both the cerebellar hemispheres. Look, you can't delineate that there are two hemispheres in this picture. You are only able to see a single structure in the posterior fossa. So this entity is called Rhombencephalosynapsis. Now what is the pathophysiology of this entity? Any insult between 28 to 44 weeks of gestation leads to partial or complete absence of vermis, which in turn leads to partial or complete fusion of cerebellar hemispheres, and dorsal continuity of the both cerebellar hemispheres is characteristic. Now coming to the clinical features. Since the cerebellum is pathological here, so you will notice ataxia, abnormal eye movements, abnormal motor functions as the clinical features in these patients. Now coming to the associations. So you have to remember the two associations. First one is the vectoral and second one is Gomez-Lopez-Hernandez syndrome. Vectoral, as its name has the synonym or the mnemonic vectoral, which means vertebral anomalies, analectasia, cardiovascular anomalies. T stands for tracheoesophageal fistula, R for renal anomalies, and L for limb anomalies. And the second association, GLH syndrome. Remember R, S and T. R for rhombencephalosynapsis, S for scalp alopecia, and T for trigeminal anesthesia. Now, you will order MRI as the investigation of choice for these patients. So on imaging, you will notice partial absent nodulus, anterior or posterior vermis, or complete absence of vermis, with fusion of cerebellar hemispheres, which is seen as transverse oriented folia, continuity of cerebellar white matter across midline, fused TDS structures. This is a mnemonic made by me. Fused TDS. TDS stands for tonsil, dentate and superior cerebellar peduncle. So in these patients, I have told you earlier that there is absent vermis. So the vermis can be completely absent, or any of the structure in the vermis can be partially absent. So there can be solo nodulus absent, or just the anterior vermis absent, or just the posterior vermis absent. This will in turn lead to fusion of both the cerebellar hemispheres. Now the fused cerebellar hemispheres will appear as transverse oriented folia, which can also be said as continuity of cerebellar white matter across the midline and fused TDS, you have to remember. Now there are some secondary findings in Rhombencephalosynapsis. Because of all these appearances, the fourth ventricle's shape will be like a diamond. So fourth ventricle will appear as a pointed diamond-like structure and the posterior fossa will be small in size. Since there is a lesser structure now, since the vermis is absent, so obviously the posterior fossa will be in turn smaller in size. So these are the imaging findings. Now you know there is nothing to ratify here. Everything is just in the nomenclature. That is absent vermis, which will lead to fusion of cerebellar hemispheres, which indirectly give these findings, and the secondary findings in form of diamond-shaped fourth ventricle and small posterior fossa. Now I am showing you the T1 axial images at the level of posterior fossa. Look here, you can see the transverse oriented folia and the white matter. Look at these white lines. The white matter is continuous across the midline. So this is the classic picture of Rhombencephalosynapsis, absent vermis plus fused cerebellar hemispheres. Now coming to the secondary findings. I had told you earlier that because of the fusion of cerebellar hemispheres, the shape of fourth ventricle will change. So look at the fourth ventricle. The fourth ventricle is appearing like a diamond or pointed fourth ventricle. So this is the classic fourth ventricle appearance in Rhombencephalosynapsis. Also, there is a cute sign known as Donald Duck sign in Rhombencephalosynapsis. So on coronal images, the fused cerebellar hemispheres and the folia will give appearance as a beak of Donald Duck. Focus at this structure and focus at the beak of Donald Duck. Look, they are looking almost similar. So this sign is named as Donald Duck sign on coronal images at the level of posterior fossa. This is the again Donald Duck sign. Now never stop at just the one pathology. Since you know that the congenital anomalies are associated with some other congenital anomalies, they are rarely isolated. So you can also see hydrocephalus in these patients. Aqueductal stenosis can also be found. Absent CSB can also be seen, or any of the congenital brain anomaly or vectoral anomaly can be seen. Thank you for watching the video. This was all about Rhombencephalosynapsis. Now I will again summarize few points. So what all the examiner can ask you now? What are the questions? So question number one is identify the spotter. So either you will be given axial images or you will be given coronal images. On axial images, you will classically see absent vermis plus transversely oriented foliae. On coronal images, you will see Donald Duck sign. So once you identify the spotter, you will tell sir this is the appearance and the picture is classically of Rhombencephalosynapsis. Now next question of the examiner will be tell me the associations. So you have to remember two associations. Okay. So first association was vectoral, and second association was GLH syndrome. These are the two main questions you have to remember at the end of the day. Now, thank you for watching the video. If you found this video useful, please like, share and subscribe.